Welcome to Startup Health TV, where we celebrate the entrepreneurs and innovators who are transforming health. I'm Logan Plaster with my guest here, Chelsea Rowe, CEO and founder at Gritwell. Chelsea, great to see you.
Thank you for having me.
Let's start by just educating our audience on what Gritwell is.
Absolutely. So Gritwell is a digital health platform that addresses more complex and chronic health issues, from GI to hormonal to autoimmune conditions, which are really common today. And we use what's called root cause medicine. It was actually all inspired by my own personal health journey for 10 years, as well as our chief medical officer. I think the problem is what we see and what I experience is you go to the healthcare system and it's this revolving door of prescription medications that often don't lead to good outcomes. And our chief medical officer felt like she didn't really have the tools to get people healthy. And so that's like in essence what root cause medicine is using more tools and data to address what's driving symptoms versus just masking them.
So what drove you to start the company? Because plenty of people have autoimmune conditions and have these struggles, come up against the healthcare system. Not all of them jump into the fray and say, I'm going to create a solution.
Yeah, it was a long health journey. So when I originally went to the healthcare system, like just to go to your doctor because I had things like digestive issues and migraines and insomnia that I had developed over time. And I walked away with doctors saying, oh, there's really nothing we can do, or here, take these 3 or 4 medications. At the time, I was a young college athlete, and I was like, I don't want to take 4 medications for the rest of my life. This doesn't make sense. Why am I so sick? And so I went kind of wandering in the desert, trying supplements, trying diets, going to holistic providers, but they all massively varied in quality. Nothing really moved the needle. And so it wasn't until I found a doctor who was trained in root cause medicine, which, as I mentioned, is just looking at more data and testing to understand what's driving symptoms, that I was able to put together really a personalized plan with this doctor to work through and get relief. And honestly, after a year and a half, I resolved all my symptoms, and I just became fascinated with how is this not the standard of healthcare?
Wow. Okay.
And I think we, like most probably entrepreneurs, through pain comes purpose, and
Yeah.
it's just
Talk to me about the market's reception to what you've been doing, traction.
Yeah, I think it's significantly shifted in the last few years. I think it's twofold. One, unfortunately, people are getting sicker. So there's way more frustration with the one symptom, one pill model, right? Of like, hey, I went to my doctor and my medication isn't working. I'm switching medications and I still don't feel great.
Yeah.
And so people are really searching for more comprehensive care. And so we're seeing a huge demand and shift for root cause medicine because of the outcomes that we get specifically for these multifaceted, complex issues.
Is root cause medicine related to the idea of holistic, sort of whole person care? The idea that we're just factorial people?
Yeah, absolutely. I actually started the journey not just from my own experience, but I spoke to 3,400 patients in the early days.
Wow.
And each patient that I spoke to didn't just come in and have migraines. They had multiple symptoms. I think the problem is with the fragmentation of our healthcare system, we're always just looking at one issue. But most people are migraines, they're tired, they're not sleeping well, they have hair loss, they have skin issues, and they don't just want to focus on one symptom. So with root cause medicine, we're looking at all the various different organs, all of the symptoms that you have, and addressing that at the root so that you can truly get better outcomes. And we're not just playing whack-a-mole.
Talk to me about the actual user experience. If I'm someone that has a autoimmune disorder and I'm using Gritwell, walk me through that process.
Yeah, so what I think is important to note before I answer that is we address the full spectrum of health. So you could have early stage, and whether it's fatigue, energy, migraines, or you could have a severe autoimmune condition, and we're actually going to address it in a similar way. So a patient's going to come in, and we are going to do a data-driven analysis to look at all the factors that most doctors don't have time to ask. Environment, lifestyle, food, antibiotic use as a child, exposures, all sorts of things. And then from there, we help to really just start identifying imbalances and drivers of symptoms. So do they have hormone imbalances, nutrient deficiencies? This is all through what we call a root cause analysis. It's also paired with comprehensive blood work. And then after they do this root cause analysis, then we have a good picture of what's going on, and we move them into our care model where they work with an MD and a health coach, and they meet every other week over the course of 6 months, working through their personalized recommendations.
Nice.
And that's when we start seeing movement each month. We work through phases, so it might be hormones, and then we work on the digestive system, and then we detox them. So it really depends on the individual, but
So there's a strong one-to-one sort of health coach component in addition to the digital clinic concept.
Yeah, I think, the beauty of it is you do need a medical doctor to screen for some of the really, tough things but you also need a coach because a lot of it is behavior change, right? Some people come into us and they're eating horribly, they're not moving their body, they're doing all these things, and they want some magic supplement to fix everything.
Sure.
No supplement's going to fix it. No pill's going to fix it.
Yeah.
It's really a combination of all of these things in order to really get good outcomes. You have to take into account all the pillars of health.
You mentioned that you'd raised, before we start the interview, about $3 million so far. What are you looking forward to next?
Yeah, so I think raising, one of the best things about it is it gives you the resources and tools to be able to continue to build the business and potentially at a better pace and capitalize on some of the things you're seeing. And so our last round was fantastic because it allowed us to build out our team, build out our product, and we really have a huge data component. And we want the technology to help us scale root cause medicine effectively and ensure that the quality scales with us. And so that was the first round. This next round is really allowing us to capitalize on the other scalable channels that we're growing into. So working with employers to reduce costs on various different claims, as well as working within the healthcare system. So for example, we are going through an accelerator with Blue Cross and working to, ideally we want to work with the entire U.S. and democratize this care. Yeah,
that kind of answers what was going to be my next question, which was your go-to-market in terms of direct-to-consumer or working with insurers and employers. Are you finding that the conversation, are they more receptive to this idea than they were 2 or 3 years ago?
Oh yeah, hands down. I think we really needed to prove out the value, and we wanted to prove clinical outcomes, that we were going to get people healthy, that we could reduce medications, we could reduce specialist visits, we can improve happiness, all of that. And we did that direct to consumer.
How did you go about that validation? Because it's not easy.
No, the direct to consumer markets is tough. There's a lot in there, and there's a ton of point solutions, and honestly, patients don't know what to do.
Yeah.
So because I had all of these early conversations with patients, I really, really understand where that's coming from. So I did do a lot of videos. We did tons of testimonials. We did, some obviously paid advertising, but a lot of influencers as well, which was really helpful. And there's just such a shocking amount of people who are desperate for this type of care that we ended up being able to find that niche and that funnel easier.
Interesting. Who would be an ideal partner for you, let's say 2024?
Like strategic partner?
Yeah.
So
if you could be speaking to anybody through this video who would call you up, who would it be?
I really truly believe this needs to be integrated within the healthcare system because that is the behavior of a consumer. And I think, if it was any sort of health system, payer, those are really the next relationships we need to start to develop.
Let's say I'm a patient at Kaiser. I go into my primary care doctor. I've got these migraines. I've got these issues. I'm maybe early stages of what could be an autoimmune. They send me home with this platform that becomes my journey.
Yeah, absolutely. So many patients, as I mentioned, are so frustrated because doctors are doing their best, but even if you have 30 minutes in a one medical model, you're trained to kind of stay in your box, which is to identify a diagnosis and prescribe a medication, but not everyone fits in that box.
Yeah.
So you have people who have all these unexplained symptoms, and so the doctor wants to help, but they're like, maybe try this diet here, there's nothing we can do, switch your medications.
5 minutes
People are getting worse and worse, and then they developed an autoimmune disease 4 years down the line because we didn't stop it when we already had warning signs in our body. And so by partnering with Gritwell, we can say, hey, listen, let's take the strain off the doctors, improve the NPS of your system, as well as reduce cost and really the rising pharmaceutical costs that are out of control.
Yeah.
And so by saying, hey, let's partner with this, whether it's a vendor or however we decide to work with them, we can then report back and say, hey, here's the outcome. This is what we did with the patient, and here's why they're better, and they haven't been, continuing to come back in.
It's cool.
So it's collaborative.
I like it. Chelsea, I appreciate you coming here to give me the update. It'd be exciting to see where you grow in 2024, and if you find those really great strategic partners to start partnering with health systems and insurers, and I think you're going to help a lot of people. So thank you.
Awesome. Thank you.
All right,
I appreciate
thanks, Chelsea.
it.
Be well.